Hi, I'm State Representative Kim Moser. I represent the 64th District in Northern Kentucky. I have Taylor Mill, Independence, some of Covington, Latonia, and down into Ryland Heights. I have been married for 38 years to my husband Neil, and we have 5 sons. They are all grown, and we have 3 grandchildren. My background is in nursing. I have my BSN from Spalding University. I did some graduate work at University of Kentucky in architecture. I served as a neonatal intensive care and flight nurse for many years, and then later I served as the executive director of the Northern Kentucky Office of Drug Control Policy. It's a great honor to serve as the chair of the Health Services Committee in Kentucky and really have a lot of say in what issues we tackle, to really listen to our constituents and understand the healthcare needs of Kentucky. I grew up in a medical home. My father was a primary care physician and my mother was a nurse. My husband is a physician, and so we really are pretty surrounded by medicine. I remember early as a child going on house calls with my father, and really had an interest in healthcare at a very young age. I have, as an adult, really spent a lot of time advocating for healthcare, quality healthcare in Kentucky through the Kentucky Medical Association Alliance. I served as the state president. I also served as the national president of the AMA Alliance. And those are groups that are really the volunteer arm of organized medicine. And we really understand, as the family of medicine, how government bureaucracy affects the practice of medicine and patient care. Our committee this year will continue to focus on access to care. We have had conversations about basic coverage versus a bridge insurance plan, which would include employers' participation, and so we're having those conversations. We still look at barriers to care, things like prior authorizations and the limits it places on a patient's ability to get their health care when they need it. And it also increases the administrative burden for our healthcare system. We're looking at Medigap, we're looking at a lot of different issues that really get into the crux of what is interfering with the ability of individuals to get the health care that they need and be the healthiest that they can. We're looking at the cost of health care and the cost of pharmaceuticals. We would like more transparency around the healthcare system as a whole. We're looking at the Kentucky Health Information data collection program that we have in Kentucky. I'll continue to work on addiction treatment and prevention. We have a really robust cannabis research program that we would like to increase in Kentucky, and really take a look at whether or not cannabis is something that can be used to help alleviate symptoms in some patients. We will look at perhaps regulating some of the over-the-counter kratom and other over-the-counter controlled substances that we're seeing, and I believe that it's problematic that we're seeing these in gas stations, convenience stores. We have transitional housing issues to address, and some awareness campaigns to increase prevention of substance use disorders in Kentucky.